All right, with that, I'll introduce myself. My name is Jackie Gasperlin. I'm 26 years old and I'm living with cystic fibrosis. I'm also a certified physician assistant, or PA, so I have the privilege of both being a CF patient and working in medicine. So I get to kind of see both sides of what we're talking about today, and I'm so excited to be here with our awesome panelists. It's going to be a great session, I can already tell. As many of us know, but we're going to discuss a lot more today, CF is a progressive genetic disease. I was born with it in 1994, and I was diagnosed thanks to the newborn screening program. Back in 1994, when I was born, only a handful of states were screening for CF. I was just lucky to have been born in Wisconsin, which was one of the states at the time. Without the newborn screening program, no one else in my family had CF. So it's hard to say when it would have been caught. So I'm so thankful that it was caught so I could be treated right from my time as an infant. 2 years later, my brother was also born, and it was discovered that he also has CF. So I'm also in a unique position of having a CF sibling, which isn't terribly common. And we like to say it's both a blessing and a curse. Having a brother with CF was great to have someone who was going through the same treatments and appointments and problems that I was. But with CF, there's a bit of an infection control concern in which people with CF aren't supposed to get terribly close with each other because we risk passing infections to one another that aren't contagious to the general population, but for someone with CF can be. So we had a careful balance as siblings where we were often in the same environment, so we accepted that we would get maybe some of the same infections, but whenever either of us got sick, it was very important that we stay away from one another. So it was an interesting balance growing up with a brother with CF, but it was also so nice to have that other person to connect with and go through and talk through these things together, because sometimes CF can be an isolating disease when you can't meet up with other people with the same condition. Thankfully, today we have social media and so many other ways to connect, such as this. So it's gotten easier and easier over the years to really become a part of this awesome community. So growing up, I felt fairly healthy. I would get sick once in a while, and I always thought my parents made a bigger deal out of it than it was, but I understand now that they were really protecting my lungs that were at such risk. I was in and out of the hospital a couple times, and antibiotics were a regular part of my life, but otherwise I felt I was living a fairly normal life. And then in 2018, I was thankfully blessed to be put on a trial for Trikafta, which, for those who don't know, is a modulator drug. It's a pill you take twice a day that has nearly revolutionized CF care for those who qualify for it. Luckily, with my genetic mutations, I did qualify. So I've been on Trikafta now since 2018, and it was only after starting Trikafta that I realized how sick I actually was, because suddenly all these symptoms that I was having slowly disappeared. I was waking up without coughing every morning, which I had just accepted as normal. I had more energy. I put on weight easier than I ever had in the past. And it just really opened my eyes to what a normal person feels like. And it was so incredible. It's been one of the greatest blessings of my life. And I'm just so grateful for the advancements that the CFF has really forged forward for us and to be on this life-saving drug. And in the last year, I have been healthy. I haven't been hospitalized since starting Trikafta, which has been a huge victory. And then the last year I got married and I graduated from PA school and am now starting to work as a physician assistant. So I'm so grateful to be here with you all today and talk about CF. Now I would like to introduce our first panelist. We're so excited to have Dr. Moore. Brook Moore, MD, MPH, is a pediatric pulmonologist at Children's Respiratory and Critical Care Specialists. She is the Associate Medical Director for the Cystic Fibrosis Center at Children's Minnesota and the Co-Medical Director for Respiratory Therapy at Children's. She serves on the Board of Directors for the Minnesota chapter of the Cystic Fibrosis Foundation, and as Vice Chief of Staff, currently serves on the Children's Minnesota Board of Directors. Thank you for being with us, Dr. Moore.
sorry, my mute button moved, and I'm in a room where you're on a screen up above, but I need to look at the camera down here. So I'm going to try not to look at myself. Thank you for having me today. As you mentioned, I'm a pediatric pulmonologist at Children's Minnesota. Part of my role today is to talk a little bit about the medical advancements, such as Trikafta that Jackie just mentioned. And before sort of getting into the modulator therapy, I think it's important to take a step back and look at how far we've come. So in the last 40 to 50 years, there have been major changes in the medications that are available to treat the impact of cystic fibrosis. So initially we had just pancreatic enzymes and airway clearance, and later Pulmozyme hit the market to help thin mucus and minimize inflammation. And then tobramycin was approved. And so each sort of decade, there have been major advancements, particularly over the last 4 years. And then thankfully, almost 10 years ago now, the first modulator came to market in ivacaftor, and it revolutionized CF care. So it took the basic defect for some patients and it repaired the problem. And so like Jackie mentioned, we have people who are now living without clear symptoms of cystic fibrosis. So we had ivacaftor approved first, and then later Kalydeco, and then later Orkambi and Symdeko, and then a couple years ago, now almost Trikafta, which last week was now approved down to age 6. And the beauty of these modulators is that not only do they restore function of that cystic fibrosis regulator protein in the lungs, but they do it throughout the body. So cystic fibrosis impacts pretty much anywhere in the body that there is mucus. And we're hearing from our patients that the modulator therapy, particularly Trikafta, has changed their life. Unfortunately, it doesn't work for everybody. And so there's still about 10% of patients who do not qualify for highly effective modulator therapy. And so our work continues to treat the impact of the disease in those patients. Like Jackie mentioned, and when she said she hasn't been hospitalized, our hospitalization rates in our patients who have cystic fibrosis have plummeted since the advent of these modulator therapies. And even in the setting of COVID, we've had very few hospitalizations in this last year. But when we look at data over the last 5 years, it's been a steady decline in the number of kids who are hospitalized. That doesn't make the role of the care center or our care team any less important. So years ago, there was some effort to sort of look at the value of the care centers and what they bring. And the foundation has guidelines for our standards for what we're supposed to do in practice, and it measures what we do compared to other centers. And there really is good data that people with CF who are cared for in centers do better. Our center consists of physicians, nurse practitioners, nurses, physical therapists, respiratory therapists, social workers, geneticists, research coordinators, and each person in that team is important to the care and well-being of our patients. So as a physician, sometimes with the highly effective modulator therapy, I'm feeling like there's less importance for my role, but certainly things like anxiety and depression are more common in patients with cystic fibrosis and in their caregivers. So the role of our social worker can't be understated. Our dietitians historically have been focused on helping people with CF to gain weight, although what we're seeing in our patients who are on modulator therapy is that sometimes they've actually had excessive weight gain, and we're having to sort of refocus our conversations about, what does healthy eating look like? What does a healthy lifestyle? What's a more normal approach to living rather than the high protein, high fat diet of old? So there's still, even in the era of modulator therapy, a role for our dietitian, albeit a different role. Our research coordinators are really important into helping to get people like Jackie enrolled in studies when new medications come out. One of the beauties of the foundation is the effort that they have made over the years to invest in research and to stimulate the progress towards a cure. And our research coordinators really help us to make sure that we are participating in studies and keeping abreast of the cutting edge therapies. Even patients who are on modulator therapy at this point, we're still asking them to do respiratory treatments or airway clearance treatments. The respiratory therapists continue to play an important role, and particularly so in our patients who don't qualify for those therapies yet. I think physical therapy is really important for our patients, particularly as we talk more about a healthy lifestyle. How do we make sure to just be healthy humans? So making sure that people are exercising on a regular basis to promote both their lung health, but just their overall health. So I think I'm just gonna look at my notes here and make sure I don't want to miss anybody. I think I talked about, and then our nurse coordinators, well, they're our bread and butter. They answer all of the questions that families had and have, and I can't do what I do if it's not for the nurses who help me to take care of people. But I think that's most of what I was asked to at least start out with, and then I'm happy to answer questions as we move forward.
Sorry, I was on mute there, but thank you, Dr. Moore. That was awesome. I couldn't agree more. The CF Care team has been so instrumental throughout my whole life. I'm so close with all of them, and the whole team is the reason that I'm able to be as healthy as I am today. Thank you for all that you do. That was great to hear. I would like to shout out, if anyone has any questions, please put them in the chat. We're so happy to take questions at the end of this session and talk about whatever's on your minds. Next, I would like to introduce Christina, another really important person in our CF community. Christina Bond is a licensed master's social worker working with the CF clinic at St. Alexius Medical Center in Bismarck, North Dakota. She is passionate about helping patients who have CF, as well as families of children who have CF. She's an advocate for patients and families and strives to have the best possible interactions with all of her patients. So thank you. Welcome, Christina. Thank you for being here.
Thank you so much. I want to give a thank you to Drew, who encouraged me after a short conversation with him that this is something that he would like to see me be a part of. So I really want to thank the Cystic Fibrosis Foundation for reaching out to me. I am new to the Cystic Fibrosis care team. I have been a part of the care team since September of 2019. And it was an assignment given to me because the social worker that I was hired to take over for had been doing it, and that's what I was supposed to do. And so I kind of came into it by default, really. And when I came into this role, I learned that my learning curve was going to be straight up a mountain. I knew nothing, but was eager to learn everything that I possibly could because my passion runs deep for people, whether that's people with a chronic illness, an acute illness, something that has changed and impacted their life, whether it be for a season or for a lifetime. I want to be a part of that. I want to be a part of that team. And our team here at St. Alexius has really brought me into that and helped me learn and grow. And I'm so grateful that I have been a part of the lives of these patients that we serve here in Bismarck, North Dakota. We serve from all around the state, and it is a blessing to be a part of their lives, their journeys, to see a child who's come in from a newborn screening, to know that I get to be a part of their team and watch them grow and thrive over the course of their life is a really awesome opportunity for me, to be a part of families through their journey, through their everyday struggles, and then challenges that come up, whatever those might be. So I'm just really glad to be a part of this team, glad to be a part of learning more every day about cystic fibrosis and advocating for my patients, my families, and educating the people in my life and the community. My children learn every single day. They know when CF Clinic is, they know what to ask me for questions. They're very excited. They heard the story of 65 roses. And so it's just an amazing thing to be a part of. So I'm really glad to be here.
Thank you so much, Christina. We're so happy to have you here today too. So as a final reminder, please add your questions to the chat. We're so happy to start some question and answer right now. If you have any questions for myself, Christina, or Dr. Moore, we're all here to answer whatever you have. All right, it looks like there's no questions entered yet. I might start with one. Christina, I know there may be some families here who are new to CF with a new diagnosis. Do you have any advice, or what does that first year look like? I of course, was an infant at the time in my life, so I don't remember that, but my parents talk about how stressful it is to get that first diagnosis. So do you have any advice for any new parents?
The first thing I would say is, as early as you are scheduled to come in for an appointment, come in, meet your team. Like I said, this is a team who's going to be with you through your journey, hopefully through life. And we're going to see you grow and change and do all the things that we love to see in our CF kids. So I would really encourage you to come in for that first appointment. Here in Bismarck, our goal is to have those first 6 months of life after that newborn screen to be coming in every month. It may seem like a lot, and we are not going to be ridiculous to think that it's not. Like, we know a day with us is truly a day with us. And so we know that it takes a lot to come and be here every month, but it will solidify the trust, the relationship, the rapport, so that this team becomes the people that you trust. If there's a cough or a sniffle or anything different with babe, you know that you can call us, because we know your baby, you know your baby, and we're going to work together for the best for that baby. And we want to be a part of that. We want to be a part of helping them be healthy. There's all the newborn stuff that people have to do. There's newborn visits, there's shots, there's all those kind of things. So we're just an added layer of knowledge, protection, information, and hopefully, like I said, building trust and rapport. If we build that trust and rapport, then you are more likely to come back for their lifelong care. I think too, it's a really good foundation to begin by meeting all the team members, so that you start to know who you can call for what, and what you need to start looking at. Is it a matter of getting set up with, maybe you don't have insurance and you're panicked that this is going to really impact your family, your life, your finances. We want to get that started right away. We want to connect you with the resources to do that right away. You're worried about paying for things. We want to make sure that you're linked with all the places, with HealthWell, with Compass. We want you to not feel out of control in an out of control situation, because sometimes that can feel that way when you get a new diagnosis for your child. Because this isn't just a diagnosis for your child, it's a diagnosis for your family. And we want to be there to support you. And so I really feel it all comes back to keeping that appointment, making those connections, and just joining our family, because that's what we are here.
Awesome. Thank you so much. And I know you mentioned Compass there. If anyone doesn't know who's tuning in, Compass is a tool that I've used so much as a CF patient. You can find it on the CF Foundation's website. It's a number you can call, and it is an amazing team there to help you navigate anything cost or insurance related. I've used them for travel and navigating when I turned 26 and had to find my own insurance. I cannot underemphasize what an important tool that is, and I would utilize it every chance you have.
Yes.
Yeah. Anything else about that, Christina? Because I know Compass is near and dear to my heart, and I want to make sure everybody knows about it.
I have been able to reach out to Compass in situations where I had an aging CF patient who was needing to change his apartment. He could not continue to do 18 steps every single day, multiple times a day, carrying oxygen, and as he was aging. And so we were working with Compass to work on some assistance with some moving support, whether that be, just the financial resources to help somebody come and move him. Because again, oxygen, aging, he was struggling to think, oh, what a daunting task to move. Many of us don't like to move on a great day. So he really didn't want to move, but he knew he needed to. And so working through Compass, and they were amazing to communicate with. They got back with me right away. They really had a heart for the patient, not even knowing who he was. So I know that they can do that for anybody. They can work with people in those situations.
Awesome. Thank you so much. I see some questions are coming in, so I will start to read them off so we can get them answered. Here's one that says, the amount of daily treatments and therapies some with CF must do can feel overwhelming. What advice do you have for making these daily tasks easier and less daunting, especially for young children? I can probably start to answer that as a person with CF. The treatments are burdensome, and there's really no way around that. For me personally, the vest is what is the hardest for me, because it's something that I put on and wear for an hour a day to loosen the mucus in my lungs, and finding that hour in a day, in my case, I do 2 half-hour sessions, but I know it's different for everybody, is hard, and you're busy. And especially as a child, I remember not wanting to sit still. There's so much to do. I would get so angry when my mom would call me in from playing with my friends because it was time to do my treatments. So it is overwhelming. I totally agree. Some tactics that we used when I was a kid is that when I did my vest or my nebs, that was when I was allowed screen time, and that was all I was allowed screen time. So it became associated with something that I really liked as a child. That was when I could watch my cartoons. I know screen time has evolved a lot since I was a kid, but that was a good way to keep me focused and calm down, and it was a small reward for doing something I knew I had to do. And of course, growing up with a brother who also had to do the treatments was really helpful, and seeing someone else who had to do this, so I wasn't completely alone. But Dr. Moore, Christina, if you have anything else to add, we're happy to hear.
I can speak to that a little bit. So, we try when, particularly when kids are little and it's a new diagnosis, to just add one therapy at a time. And as we were talking about before, the first visits are about building rapport and trust, and you have to establish a relationship. And then after a couple of visits, we gradually add in one thing at a time. And I feel like it's easier if we have families start doing treatments when children are little, because it just becomes part of their normal routine. It might not be normal compared to their friends, but it becomes what they expect. And then they seem to question things a little bit less as they get older. Families who wait to initiate therapies, or when we have kids who come in and have a late diagnosis and have to add the therapy, that's a lot harder than if it just becomes routine when people are little. I think the other component that's important is educating families about why we do each thing and what medicine does what and why the vest, why when they're babies do we do manual bronchial drainage, and really stress that those things are meant to help them to lead long and full and healthy lives. And then I think it's also important as kids get older and they start to question and push back, which is totally appropriate, that then we take time and we talk to the kids too about why we're doing what we're doing. And I think doing so in a way, obviously that's not frightening, but just to help them explain. And I think the one conversation I've had with sort of kids who are in their tween years and are starting to question and push back is, why me? And I'm the only one who has to do these things. And in reality, all of us have something, and that's the conversation I usually talk to them about. They usually have a friend who has a peanut allergy, or they have a friend who has celiac disease, and that a friend who has diabetes, and their thing is that they have cystic fibrosis. And yes, it's a lot and it's not fair, but that if we do these things, they're going to stay healthy and be able to spend more time doing the things that they love. So that's what we do, at least here at Children's, in terms of trying to help make it less overwhelming.
Thank you so much, Dr. Moore. That answered the question perfectly, I think. While we have you, there's another question for you, Dr. Moore. They ask, in addition to therapies like modulators, inhaled medications, enzymes, etc., what other daily treatments and lifestyle habits do you recommend to someone living with cystic fibrosis?
So we really encourage our patients to get aerobic exercise, at least 30 minutes every day. There are clear studies that show that 30 minutes of exercise is like doing an extra airway clearance session. And so even from a young age, whether it's a little mini trampoline when kids are developmentally old enough, or a trampoline outside, or participating in sports, we really encourage our patients outside of the, traditional medicine things that we ask them to do, just to try to be active. We have certainly seen through the years that, our patients who are in organized sports or who dance or whatever their activity is, those who are in more consistent activities, they do better than those who have a sedentary lifestyle. So I think like I mentioned before, the other part of it is we're starting to have to shift our conversations about diet and having a more healthy, balanced diet, rather than the focus on high fat and high protein. So kind of the things that you would recommend really for anybody, but those are the main things are exercise, healthy diet, and then obviously asking them to follow our recommendations as closely as they can.
Yes, thank you, Dr. Moore. And you touched on it a bit there about nutrition and how it's changing, but so important with people with CF. Someone asks, what are some of the basics for good nutrition and cystic fibrosis?
Well, having a good nutritionist at your CF center is important. I think, in fact, right before I came in for this, I was meeting with a teenage patient, and we were talking about a healthy plate approach. So the idea that you divide your plate into 4 quadrants, and you have at each major meal, you try to have 2 fistfuls of fruits and vegetables, 1 fistful of protein, and 1 fistful of carbohydrates, and then obviously explaining what falls into each of those categories, and a thumbful of fat. And that if we all ate that way for all of our meals, whether you have cystic fibrosis or not, that would be more helpful. Of course, I don't always practice what I'm preaching, but trying to make a concerted effort to eat more fruits and vegetables, but also have a balance of protein and fat. With infants right now who don't necessarily qualify for modulator therapy, or for patients who have genetic mutations that don't, we still continue to focus on that high fat, high protein diet. And our goal remains for patients to have a BMI that's right around 50%. So, we know that lung function, life expectancy all improve when your BMI is near the 50th percentile. But there is an inflection point where if it's too low, you see problems, but if it gets to be too high, we see problems too.
Thank you so much. Here I have another question for both panelists. So maybe Christina, you can start us off. They say mental health has become a major priority in the CF community. How do you support or provide guidance to individuals who need help navigating the emotional and mental side of a life with CF?
Well, one of the things that when I first spoke about building that rapport and trust, I think it's important, no matter the age, to start building that. And so here at St. Alexius, one of the things that is kind of my mantra that I say is every patient, every time. So it may not be an annual visit. It may not be a scheduled time, but our goal is that they see social services, social work every single time that they are here for a clinic visit. And life may be going great. Life may be full of wonderful things and no depression and no anxiety and no mental health concerns or issues. But it's the trust building and it's the rapport. So we make sure that we have those visits every single time. And we ask the questions. How are you sleeping? How are you eating? How are you feeling? How are you still interested in the things you like? Are there things that bring you joy? What are you doing for work? How is work going? We ask a lot of the questions that might not even be on a traditional patient health questionnaire or the general anxiety disorder screen. We are asking questions because we know our people and we want to know more. So really asking them sometimes the harder questions, like during COVID, we've had many who have been able to work from home and now they're being asked to return to work. Does that create a sense of heightened anxiety now that they've been able to work away from the exposure to COVID, to the germs that they were concerned about? And so really supporting people in that decision, supporting them in the way that we hear them, what they really are saying in the underlying, because sometimes they don't say all the words. But if we know our people and we've built that trust and that relationship in seeing them every patient, every time, then we are going to be able to hopefully try to read between the lines too, and bring it out of them and say, well, how are you really doing? I hear you're saying that you're doing fine, but tell me more. And really helping people frame their emotions. Some people haven't had to, they haven't known how to. And to say, this is what sadness feels like, this is what depression feels like, this is what anxiety looks like, and helping them really understand those things. And then making sure that they're connected with the right people. Their CF team, I want to be the person that they can talk to if they have a bad day, if they have a struggle, if they need that support. But I may not be the only person, and they may see me as part of the team for cystic fibrosis, and they want to go to a counselor that doesn't see them as someone who has CF, but just sees them, period, as a person. And stepping away from our team to get that kind of support, that's okay, and that's encouraged. So helping them know that they've got a whole community of people who can wrap around them. And we have great mental health supports here right within our facility, and then we have agencies outside and in our other outlying communities that our patients are coming from. So linking them with those people so they know they've got all the support they need.
Awesome, thank you so much. Mental health is such a huge part of the community, as it is with so many people with chronic diseases. So thank you for addressing that, and thank you for bringing the question up in the chat. Here's a good question that maybe we should have addressed right at the beginning, but someone asked Dr. Moore, can you please explain a little bit more about what CF is? Is it genetic? What are mutations? How is it diagnosed? Maybe from a doctor's point of view, just a small overview of what the disease is.
You're right. Maybe we should have started with that. hindsight. So cystic fibrosis is a genetic condition. It's autosomal recessive. So you get a copy of one gene from one parent and a copy from another. It's caused by mutations in the CFTR gene, or the cystic fibrosis transmembrane conductance regulator. It's a mouthful. And in people with cystic fibrosis, that the gene then encodes for, well, in everyone, it encodes for protein. And in people with cystic fibrosis, the protein becomes dysfunctional, meaning that it just doesn't work properly. And that protein's job is to move chloride in and out of cells. And when chloride, which is a component of salt, moves in and out of cells, water moves in and out of the cells. So in people who have cystic fibrosis, that chloride transport is impaired. Therefore, that water transport is impaired, and it results in thick mucus in various organs in the body. So mucus becomes thick and sticky in the sinuses. It becomes thick and sticky in the lungs. It becomes thick and sticky in the gut, the pancreas, the liver, in males, in the vas deferens. So as I mentioned at the very beginning, pretty much any organ in the body that has mucus can be impacted by cystic fibrosis. So I think that's kind of the main things. In terms of how is it diagnosed, so the gold standard for diagnosing cystic fibrosis remains a sweat chloride test, where they put a little band on the arm or leg and they stimulate sweat production, and then they measure the amount of chloride in the sweat. And in people who have cystic fibrosis, that chloride level is elevated. Now with newborn screening, so newborn screening was first available in Wisconsin, as Jackie mentioned at the beginning. Since December of 2009, it's been available in all 50 states. And so most babies are picked up by newborn screening in their states, and that's not with a sweat test. So depending on the state you live in, there's different screening tests that are done. In Minnesota, we have a 2-tiered test. We screen for something called immunoreactive trypsinogen, or IRT. If that's elevated, then the blood spot is tested for 39 of the most common genetic mutations and 4 variants. This is specific to Minnesota. Other states have different protocols. If that secondary screening test is positive, meaning a gene is identified, or if the IRT is really elevated but no gene is identified, then the child is referred to a CF center to have a sweat test for the confirmatory test for cystic fibrosis. The part of the reason they're referred, even if they have an elevated IRT and no genetic mutations found, is that over 1,800 mutations have been identified to cause cystic fibrosis. So we screen for the most common ones, but the test potentially could miss other more rare mutations. I think that answers most of the question.
Yes, thank you. That sounded like a great overview. I may keep you on. I found a few direct message questions. I apologize for those that I was missing earlier. Let's see here. Someone asks, after CF diagnosis for their child, how has the mindset of parents changed over the last few decades with all the advancements recently in therapies and drugs?
So I feel like the mindset has become much more hopeful. I know for me, when I have a patient with a new diagnosis, that first visit really is spent talking about a message of hope, about the CF Foundation and what it is and what it represents, and what it has contributed to advancing care of people with CF, and also the steps made towards a true cure. And I would say that that is reflected in families too. Even our families who have older children, teenagers, young adults, as these new medications that maybe they heard about when their kids were little that might come someday, as those medications come to fruition, when Trikafta gets approved down to age 12 and now it's down to age 6, and people are excited. People believe that someday there will be a cure, and they'll be able to look back and say that was something that we used to have.
Thank you so much. Another question here, Dr. Moore, you could take this, or I think Christina could address it as well. That being a CF care person is a hard job sometimes. And how do we best support or give advice to people who are taking care of someone with CF, whether that be a parent or other family member?
I think it's hard to know exactly what to say when that hasn't been your experience. But I think that most of us can come up with something, just like Dr. Moore was saying, we all have something in our life. So I think the first thing for me is finding something that's relatable. I have a child who has autism. So for me, going through that process of finding out that he had autism and hearing the diagnosis and all of those pieces, I can relate to a family finding out that their child has something that they didn't expect. And so I really try to listen to what are their fears and what are their concerns. I've had a mother say to me, I don't know how to do this. And I can't make another baby. This is my last baby. What if this takes him? And I have been able to listen through that pain and share with her that we are here for her. We have the resources. We have the people that can help her. We have all of the tools. And every single time that I see her, we can focus on, has that fear changed? Is it different as he's aging, as you're going through what you're going through? What's working well? What's not working? Where do you find support? Who do you have support from? So asking a lot of questions and helping them see that they have more tools and more support and resources than they maybe even know. Sometimes they don't think that they can reach out to family. They say, oh, I just don't want to bug my family. They've got a lot going on. Well, put that in your family's hand. Ask, and if they don't want to, then they don't want to. That's okay. But asking and reaching out, there's no harm in that. And that's why it's important that even when children are little, that I'm doing those depression screens, anxiety screens with moms and dads. I'm talking to them about how are they doing as a couple? How are they managing, treatments, children who don't have CF, time together, work, all of those things. How are they managing all the things and struggles of life? Because we all go through it.
Thank you so much.
To kind of piggyback on that, I do think, like Christina was mentioning, connecting them to other support systems. So I think getting parents involved in the local CF chapter, if they're interested, so that they don't feel so isolated, so that they can learn from families who have walked this journey. I know here at Children's, and it's true at the university, there's parent advisory councils. I tend to discourage parents from joining social media groups, which I know can sometimes be a source of information for them and a source of support, but I also worry there's a lot of misinformation and that it can be anxiety provoking. So I try to focus more on the local resources rather than sort of the Facebook, Instagram groups to try to help people just feel less alone.
I would agree with you on that as well. I know social media can be an easy tool to go to, but there can be discouraging things that I've seen among other parent groups of other areas. A lot of comparison of my kid versus your kid, and my symptoms versus your symptoms. And this always works for me, and you should always do it this way. And not so much an open-minded, supportive conversation, but it can turn into a very, very judgmental platform. And we want to discourage that as much as we can. We want to provide the support instead of that judgment. There is no judgment in this. I don't walk every day in your shoes with your children. But I know that this is not always easy. And so I don't want to sit in judgment. I want to sit in support. And in order to do that, giving them those avenues and those tools, hooking them up with the CF Association, with the CFF, and making sure that they are connected. Another tool that we have started to utilize is the talking with patients such as yourself, Jackie, who have known since birth that they have CF, and finding out if their parents are willing to connect with newly diagnosed families and parents, and providing that encouragement and saying, look, I have a 30-year-old, I have a 40-year-old, I have a child who is no longer a child, and they've been through the same struggles as you. They didn't want to do their treatment sometimes. They didn't want to take their enzymes sometimes. They didn't want to be seen different in the classroom. But look at them grown and thriving and doing all that. So that message of hope and connecting those families who have been down this road for many, many years and can encourage each other. So trying to link those positive connections as well is something that we're trying to start here, because we want that for our new families that are uncertain right now about their diagnosis and all the ups and downs. Parenting doesn't come with a manual already. And then you add on to it, you have a kid that has something different than other kids. So, and maybe even different than your other children. And so you thought, man, I got this parenting thing nailed down. And then you got a different one that's, more unique, and you got to figure it out. So helping people through that.
As someone with CF2, another question brought up how inherently isolating cystic fibrosis is, and it absolutely is, largely because it's a small patient population and because we're not supposed to be close together and in person, and that's a huge part of how we make connections. But from a patient perspective, I can say that I agree that some of the social media support groups, I dipped my toe in those once upon a time and learned that wasn't the supportive environment I needed as a patient. But other ways on social media to build connections and meet people has been so beneficial for me, not so much through support groups, but through starting relationships online through a lot of events that the CF Foundation puts on. BreatheCon is a big online conference, a virtual conference that they were kind of ahead of the time before virtual conferences became the norm here, where there's a peer mentor system with the CF Foundation, where you can tune into NACFC if you want to connect with research. I have found so many methods to connect with people outside of these vague support groups, and then through that, meeting people online with cystic fibrosis who then become Instagram friends or people that I text when I have a question. So social media is definitely a tool that I think can be utilized for good, but you certainly have to find the right way. And as a parent, I know that I've been on the Facebook groups before, and that they're not always the support you need. I can agree with you both there.
Jackie, I would also mention that, Dr. Moore spoke about it too, parent advisory councils, patient advisory council. That has been something that I've seen for us. We have a patient advisory council that is open to our parents. At this time, I haven't had parents that had wanted to be a part of that, whether it be the timing or the schedule or whatever that might be. But we have had some of our patients who have really embraced that and started to be a part of that. And I am there as the moderator, really. I mean, just making sure that everything's set up and you know, kind of start off with a prayer and a topic, and if they want to talk about whatever they want to talk about. And I have seen grown adults who used to get together for meetings in person before we were like, oops, we shouldn't be doing that. And they are like kids again. They're like, I can see all my friends that used to sit in a room with me and hang out while our parents had a meeting across the hall. And here we are. And so I can see that camaraderie. And that's really great to see. So the more that we can give those avenues right within our own clinics, I think everyone will benefit.
Yep, I completely agree. I think even this COVID world has revolutionized virtual meeting platforms and has done nothing but good for the CF community, where virtual has become the norm, and now everyone has the platform and hasn't figured out how we can make this an option for those of us who can't always be in person in big groups or with the people we most want to connect with. Oh, it's been great. We have a question here kind of about how the needs of CF has changed over time. So those with CF are living longer, healthier lives with the advancements in drugs and therapies. How have care centers had to adjust to meet the new needs of everyone with CF? Dr. Moore, maybe you can address this one.
Oh, that's a tricky question. So, you know, as a care center, we have guidelines that we're supposed to follow in terms of what treatments that we recommend, the standards that we're measured against. But as people have been feeling healthier, they certainly are ready to peel back and to do less. And historically in CF, we don't do less. We just keep adding and adding and adding. And so I think it's part of the art of medicine. So there's clear science and there's clear guidelines, but there's also the art where if a patient comes in and they feel great and their lung function's the best it's ever been, and they're not doing their best and they're not doing their neb treatments, I can't really argue with them, even though I'm going to get dinged because I'm not checking the foundation box in terms of meeting the standard of care. I'm learning that I just have to listen, and I have to, you know, hopefully I've always listened, but I think I'm having to listen better. I'm having to meet families where they're at, and sort of change the way I practice, and not always think that more is better, and sometimes less is the perfect option, which is not the formal recommendation of the foundation, right? There's studies looking at slowly peeling things back, but patients are going to do what patients are going to do if they're feeling good, and I have to sort of adjust my practice to meet them where they're at.
Yeah, that's something I've seen in my own journey with CF, Dr. Moore, where I have started to peel back a couple treatments now that I've been so healthy on Trikafta for over 2 years now, and it's a difficult thing to do because CF is a big and scary thing. You want to do everything you can to stay healthy, but kind of reversing that mindset of, oh, wait, if I'm healthy, do I need to be doing an hour a day or whatever it is of these treatments? And I'm so excited to see the CF Foundation putting more research into what this new normal is going to be, because I think from what I'm seeing, it looks like it's going to be a lot different than it was when I was a kid.
Yeah, I think the other piece of that is, you know, historically we have seen patients quarterly, you know, every 3 months we see our patients, except for that first year when we see them monthly the first 6 months, and then every 2 months the next 6 months. And you know, it's hard if people are healthy to convince them they need to come in and see us. And so I think rethinking the whole CF care model, you know, that's coming, but it like everything, it takes time for that to change.
Yes, I think that's so awesome to hear. I think the whole CF community is so excited to see that we even have the option to shift in this mindset and direction of maybe it doesn't need to be such an overwhelmingly burdensome disease as it has been in the past. These therapies are so good to see. And I think that's a great place to end where we are today, just that things are so hopeful, things are changing, and it's all for the better. We're all still here as a community and as supportive as ever. We have all these amazing tools available at our hands from the CF Foundation and all these different avenues. So Dr. Moore, Christina, thank you so much for being here and for sharing. I see that we're reaching the end of our hour here. This has just been totally incredible. I can't thank you guys enough for hopping on here to share your experiences, help guide people through who have tuned on and those who will watch the recording later. It's been so exciting. And to everyone who's tuned in, we hope to see you all for our next CFF EDU event in the fall. Again, this is the second part of the series of CFF EDU. We have so much more good content coming. Thank you all for tuning in. We hope this was helpful. And I hope you all have a great day. Thank you, Dr. Moore, and thank you, Christina.
Thank you, Jackie.
Thank you very much.